Hello, everybody. Dr. F. Scott Field here, and I'd like to introduce you to our newest sponsor. The NPTE Final Frontier is the review course that I wish was around when I took the board exam. For those of you who know my story, it took me a handful of times to pass that exam, and quite frankly, I really wish I had an exam review course around, just like the NPTE Final Frontier. Check out their website, npteff.com, and use the code HET at checkout for 10% off to all of our listeners and fans. Hello, everybody, and welcome to another episode of the Healthcare Education Transformation Podcast. I'm one of your co-hosts, Dr. F. Scott Field, and I have with me today somebody who I have the esteemed pleasure of just getting to know recently and starting to work with a little bit over on the private practice section side of things, Dr. Ira Gorman. Ira, thank you so much for coming on today and kind of giving our audience an insight into all things assistant dean and what that looks like. If you wouldn't mind, could you tell our audience a little bit about your academic journey and how it's kind of led you to where you're at today?
Well, thank you, Dr. Field. Scott, it's been a pleasure to get to know you in the last few months, and I'm always happy to talk about my journeys. So, you mentioned we connected from the private practice section. I started in private practice many years ago. After I finished school, I opened up a private practice. I developed that practice into multiple sites, eventually ended up selling it to a for-profit corporation that I worked with for a number of years as a clinic director. But during that time, I also went back to school and received a Master's of Science in Public Health because I was very much interested in injury prevention from the population I was treating. So when a new school was being developed in Colorado in 1994, I just finished my master's and sold my practice to this company and was looking for, other ways to use my talents and tools, although I had intended to stay in the clinical area. But this new program was being developed. People were being taken from the clinical side, not so much the academic side, even though I did have an advanced master's degree, which was very popular at that time. Remember, we did not have DPTs at that point. So, and the entry-level degree for PT was a master's. So if you had an advanced master's, outside of an MPT or something, you were very attractive to the academic community. So I jumped on board and helped develop this program from the ground up, and then eventually became an associated or affiliate faculty. And then once I left my corporate position and decided to jump full force into academia in the early 2000s, I was a part of the ranked faculty. I then started on my PhD, headed towards a terminal degree, and have been here ever since. I've been at Regis now since the beginning of the program, and has been a faculty member for 27 years.
That's awesome, man. I have a very similar journey. I didn't think I'd ever leave clinical. I just loved it too much. But, then COVID hit and things got a little crazy. And luckily I had, just finished my terminal degree, my EDD in 2018. So I thought I was going to use it when I retired, but here we are now, full force into academia and, plugging along. So, Ira, we have you on today to talk a little bit about your current position. You are currently an assistant dean at the university. Can you tell us what exactly that is? What does that position entail? What does that job look like?
Well, first of all, it's important to understand kind of the organization of academia. So when we did start our program, we were a program in physical therapy. But once we moved into becoming a school, and that was because we started a pharmacy program and a nursing program. And so each of these are schools within our College of Health Professions. Once you have a school, then you are required to have a dean. So our program director became elevated to a dean. And as our program grew over the last few years, and I was a faculty member, as I said, for many years within that school, but then as the school became bigger and we had multiple programs, so we have a entry-level DPT program, which we have a program director. We also have a post-professional program where we have a residency and fellowship program in manual therapy and orthopedics. And we also have an undergraduate HES program, and we have an OTD program that we work with Creighton. So all of those come under the school. Then the dean, of course, needs a little bit more assistance, and we developed an assistant dean position. We also include our program director of the DPT in our leadership team. So we have a 3-person dean's team, we call, which is made up of the dean of the school, the assistant dean, who I am, and our program director of the DPT. And we make all the administrative decisions and leadership decisions for the school, of course, within cooperation with our faculty. As an assistant dean, of course, the first role is to be assistant to the dean and to do what the dean needs. And and kind of step in when that person is not available or assist in decision making. But also I've taken on some particular responsibilities that I had before, but that I enjoy. I still teach, but though my teaching is less because my workload is 50% administrative. So I teach courses as needed, and I still teach my courses of health policy and diagnostic imaging and professional issues and whenever else I need to stand in. Sometimes somebody can't come in one day and I'm the go-to person because I've been here so long and I've taught probably every class. I can step in easily. So certainly with COVID, that was an ask quite a bit. But I also administer our affiliate faculty. So I run our affiliate faculty program, handle all the contracts, recruit, do training, evaluation, and of course, assign affiliates to different classes. I also manage our lab. So I have other administrative assistants who coordinate our lab and our equipment and make sure everything is working and operational and keeping our lab going for 84 students. We have a large clinical lab with 27 high-low tables and a bunch of equipment. So I stay on top of that as well. Also, because I love clinical work as much as you do, I do run our faculty practice. So we have a faculty practice on campus of about 8 faculty who work 2 to 3 to 4 hours a week. I'm probably over there about 6 hours treating patients. And we treat about 30 patients a week, 120 a month. So, and we've had that faculty practice for quite a while. And it allows me to continue in my clinical role. It also allows me to use my administrative experience as running a practice and a private practice. And to be honest with you, we run it like a private practice. And I think we really strongly that and service that we provide and how we compensate our faculty in there. So I also serve on an assistant dean's team meeting throughout the university. So I do a lot of networking throughout campus and other schools and other colleges. And that's one of my roles, to kind of be the external face of our school. So all in all, it's a busy, complicated, but very interesting workload. And because of my nature of probably being a little bit ADD, I like doing different things and I like kind of moving around, and it suits me well. The other big thing I do is I put out fires, and sometimes that's good and bad. Again, it fits my nature, but I go into work every day and sometimes I don't know what I'm going to be doing because, as I said, I'm just putting out the fires, whether it's a piece of equipment broken or a faculty not available or something we need to work within the university as far as policy or things like that. So yeah, I'm a fireman.
Yeah, I love that, Ira. There's so much to unpack there. First off, I love this talk because your university is very similar to University of St. Augustine, where, it's a health sciences college. We have a school for OT, speech, physical therapy, and a couple others as well that they're, slowly onboarding. We do have a faculty type clinic. I think right now it's kind of starting out as a pro bono clinic for pediatrics, but I think the hope is to grow that eventually, little by little. So that's on the horizon. One of the interesting things that you kind of talked about is you still teach, obviously, which is great. I think, for me, I see myself teaching for quite some time just because I love it. And I A, want to get better at it, but B, I need the experience. I think I need the reps. I like to, learn the process of teaching and learning. Having gone through an EDD, I feel like I still have a lot to implement, and a lot of it's taking feedback and closing those loops and trying to improve, semester over semester. One of the things, though, that is a huge part of being an assistant dean, it sounds like, is the administrative part of things. Did you feel like you were prepared in any way, shape, or form for that transition or that administrative load that you were taking on? Did you know what you were getting into, or how did that kind of go about?
So to be honest, and to be very frank, I probably haven't had a lot of formal leadership training. I've learned kind of on the job. I've had some great mentors and leaders over the years when I first started in practice who were.
And that's not uncommon for physical therapists, right? To just learn on the job. That's very,
exactly.
Out in the real world, that's how it is.
And so fortunately, I had a lot of clinical expertise and again, managing private practice as an owner, but then also managing the practice for a large corporation, which are different skills, but certainly then I was, exposed to management hierarchy and budgeting and certainly how to compensate individual therapists and things like that. My academic experience came from being a member of the faculty and now 27 years. So even though I didn't have specific leadership positions, stepping into the assistant dean and applying for that, I felt very comfortable because I knew the university, I knew our program, and I just knew how things operated internally. clearly, again, you're still learning on the job. And COVID has thrown us all a big wrench in it of how we operate and how the university has operated and under different constraints. So it's been kind of interesting, frustrating at times, I'll admit, but also challenging. The other thing about the administrative aspect, of course, is dealing with students. And, another great mentor of mine, Tom McPoyle, once said, we can complain about students all we want, but if no students, no job, so that's what we do, just like we talk about patients that way. So we really need to cater to their desires and needs. But students have changed a lot since I went to school 40 years ago. And so we all have to get used to that of a population or generation, let's say, that's a little bit different and has different desires and different expectations and different skills. When it comes to technology, I'm still considered the old guy who's struggling with certain technology. And of course, students take for granted certain things that I might complain about. So sometimes it's just, I am also part of my role. One of the things is I'm also in charge of the Student Affairs Committee. So certainly if there is a student issue of retention or professional behavior, that comes to me and the committee I put together. So that's actually my biggest challenge, but also, faculty as well. A lot of the faculty are much younger than I am too. So I bring up the generation thing only because I think I'm wise and have a lot of experience, but I also have to be very cognizant of that. A lot of the people are younger than I am and have grown up in a different social and educational environment, and I need to be very aware of that.
So I'll bridge the gap for you a little here. Tom McPoyle gave the keynote speech at my graduation from a master's program at East Carolina University. So he was a great speaker. We enjoyed having Tom. He's a great benefit to the profession for sure.
I can also throw one more connection. I was going to get it in at some point, but
yeah.
I'll do it now. As clearly, Stanley Paris has been a very good friend of mine over the years. And actually, he was the one who always reminded me that having an advanced master's in the early days made me very popular, very attractive to academic programs. And Wanda Nietzsche, who became the president of St. Augustine, was a classmate of mine at Stony Brook many years ago.
Stony Brook, Long Island. That's I took a couple summer classes there in order to get into my master's program. So brings me back to the hometown days for sure. I think one of the things too that's kind of funny, Ira, is that we I was a master's program, but I felt that I saw the profession heading into the doctorate, of physical therapy. So I started my transitional doctorate at ECU. I ended up having to finish it at St. Augustine, actually. And then I went on to do the EDD at St. Augustine as well. So I've kind of seen both sides of being a student at St. Augustine and now also being faculty too. So I enjoyed the program so much that that's where I ended up coming back to end up teaching. So it was neat for me. But moving forward, like I said, I want to teach, I want to get better at it. I want to do it for quite some time and get my reps in and my experience. But also I do see some leadership for me, down the line. I see possibly pursuing, positions like a program director, like a dean or an assistant dean or something, higher and higher and higher up the academic chain, if you will. Was that something that you had set your heart on and that was something you wanted to pursue, or did it just kind of happen naturally with the university growing and expanding?
It's a very interesting question, and people have always asked for me. In fact, when I first came to Regis, being a Jesuit university, a lot of people talked about the calling they had for education, and I didn't grow up in that environment, so it was actually a foreign term for me. I've always done things what have been asked of me, and that's not to downplay a different route, but I've always believed that my success, and I'm very proud of it, has been because I've been in the right place at the right time. And when somebody asks me to do something, I say, I don't even say yes, I say how and when, And so I've been in that position. When Regis decided to start a program, I was part of a clin ed group in town, and somebody came to me and said, how would you like to be part of this? And I said, sure. And then I started teaching. And not that I don't seek out for things. I've always been asked. At one point, I always said, I don't think I've applied for too many jobs in my career, because I've had jobs for a long time, but I've also been asked to do something. And then I say yes, rather than going through an application process and everything. And so I did apply for the assistant dean position, but again, I had been here for 20 years plus, and it just seemed natural when that position opened and we had somebody who left that I would step into it because I had the experience. So, it was an opportunity that was made available to me, and I just felt natural. Clearly, being at a university for a long period of time, I felt I had things to offer that would fit with that. But, again, as long as I was able to continue teaching and continue clinical work with that, I felt it was a natural position for me.
Yeah. I mean, I'm not a firm believer in luck. I feel like if you work hard enough and you do the right things and you, like you said, you surround yourself with the right people for the right amount of times, eventually opportunities will present themselves to you and you have to be ready to pounce on them when they happen. And that to me is more like what luck seems, is doing the right things and working hard and putting yourself in the positions to possibly have those opportunities, arise. So, I think that's very, well, like you said, you haven't had to apply for many jobs. People come and ask you because they know your skill set, they know your strengths. And, that's a commendable thing to have, that's a trait that I think is really perfect for an assistant dean type position. And so let's talk about that a little bit. What are some of the traits that you think really would help somebody if they were looking to get into an assistant dean position? What are some qualities they should have, and maybe what are some steps they should take to kind of start positioning themselves to move their way up the ladder?
Well, the first thing is the ability to get along with others. I mean, being an assistant anything means that you work closely with the person that you're assisting, and whether it's, some places calls an associate, which is more of a peer, but whether assistant or associate, you're under a person who has that leadership position. And I think it's important to recognize, you have comfort being an assistant and how you're going to complement yourself to that person. So having a good working relationship with that person and then other people that are around you. An assistant dean also, as I said, is a very big networking position within our school, college, and university. So I have advantage. I've known a lot of people at the university because I've been here for so long. So I can reach out and network and serve on committees throughout the university because I know people, but I've also gotten along with people. So I think it's, putting that ego a little bit aside and being able to, offer, kind of in a networking coordination plan. There's also the ability, as I said, to understand students and get along with students. And as I said, in the changing environment we've had, sometimes it's challenging, but I think it's an important because, you have to be there for your faculty and your students. The other thing that I forgot to mention earlier on, but there's another part of my life, which is, of course, APTA association work and professional. And so I've served on some boards at the state level, Colorado Commission for Affordable Healthcare. I'm presently on the state board for physical therapy in Colorado. So, for years, I was in the House of Delegates and had a number of leadership positions in APTA, including president of the Health Policy and Administration section. So the point is that I also have that networking that I can bring into the university. So as an assistant dean, I could bring those contacts in to my faculty peers and also to my students. I've had a number of members of Congress and state legislators come into my health policy class because of the work I've done at the state level. I've had presidents of APTA. Sharon Dunn has been a speaker in my class. I work closely now with Bill McGehee, who's a colleague of mine and has his office across the hall, but he's also the Speaker of the House. So I still maintain a very strong connection with APTA. And I can use those resources for my students and for my faculty and our university to get information, to network and expose our students and help them become future leaders as well through role modeling.
Yeah, I think you hit the nail on the head there, Ira. Networking is such a huge aspect of, any job or position, but more so it seems like, the higher up you get, you've really got to pull from your network to, A, put out fires sometimes, right? But B, to help the university or to help your students or, I can't tell you how many times, I've heard this just in talking with deans and assistant deans and people that, are in those positions, how A, their professional careers outreach just the world of physical therapy. They were involved in boards and committees that reached across several different professions. And that became very important because, again, it showed that you could work well with others, right? You could play in the sandbox, so to speak, very peacefully with everybody, And so I think that becomes important. But I tell my students all the time that, your network is your net worth, and I say that half jokingly because it's a cliche phrase, but it's cliche because it's true. Like you said, I very rarely have applied for jobs. It's mostly come from people that have needed something and seen my skill sets and been like, okay, you're a pretty good fit here. Would you be interested? And that goes a long way. If you're worried or anxious or struggling to try to find a job or a position, if you can lean on your network a little bit to help get you there, that's a huge benefit in the end. And then, like you said, the higher up the ladder you get, the bigger your network becomes. I mean, this podcast alone, my network has grown tenfold just by having, interesting people like yourself on and just asking them, who should I talk to? Who needs to be on the show? Who has a great message to spread, and that has really helped me kind of, branch out a little bit further than I would have if I was just working, my 9 to 5 clock in, clock out as a physical therapist or as a professor or whatever it may be, So I think the network is huge. I think
you said
that's
something very interesting about the networking, especially outside of physical therapy. And it's actually one of the things I feel very strongly about. And again, because I have a master's of science in public health. So I've functioned in this other world of public health, and I've been on boards and committees and commissions for that health policy expertise and for that population prevention public health, which I believe PT needs to move into more and embrace. And the two favorite lines I love hearing in my life are, one is, would you be interested, which you just said, which I love, because when somebody says that, they're interested in you. But the other one is, and you're a PT as well, because I've come to certain meetings because of my public health and prevention expertise and interest. And then I serve on this, and then I start talking about being a physical therapist. And I always get that line, and you're a physical therapist too. And I didn't realize physical therapists would be interested in this or have expertise in that. So I've really made that my mission. And I tell that with my students. And I think APTA is now moving in that with health and wellness and population health and terms that we just didn't hear in the past, because physical therapists were well respected by our patients. We worked at the individual level wonderfully, but now we have to look beyond that. And we have to be looked at as other health professionals, including physicians, nurses, and even pharmacists who are out there in the public eye. And physical therapists need to do a better job with that. And COVID has been, I hate to use the word opportunity. I tell people I don't like talking about COVID as an opportunity for anything when 800,000 people have died. But it has given us some exposure of our skills and tools to be able to work at a pandemic level, including stepping into respiratory therapy skills or responsibilities in hospitals, including giving vaccinations, at our university and our state. Physical therapy scope of practice was expanded to include that if we were needed to do so. So I think we were recognized as health professionals that can step in and do different things and move out of our traditional role. Not to take anything away from that, but I think we can expand it. And I hope that's where we're going as a profession.
Yeah, I think there's some really good people out there beating that drum. I think, Mike Eisenhart, Todd Davenport, yes. and some of those big names that have been preaching it for a while now.
Two people I've published with.
Yeah, exactly. I mean, it's true. I think we're a good fit, and people with a master's in public health or a PhD, even in some of the public health spaces, will argue, well, you're not completely ready for population health. And I agree, they've got some more training and some more education and schooling on us. But at the same time, I think if we put in the time, if we do the extra work, physical therapists are a great preventative type ally. I think that we can work further up the stream to try to help treat people before they get sick or ill, so that we're not treating it with meds and all down the line. I think it'll be more cost effective. I think, it's tough because you're selling insurance companies on something that didn't happen. Right? You're having to sell them on something that never really showed up. So it's like, well, how do we know your stuff worked if it didn't happen? It's like, well, that's why it worked, because it didn't happen,
It's trying to prove a negative, and preventive medicine, which is my master's degree, has always been tough for that, because you're trying to, and it's not just the insurance companies and policymakers, but it's patients as well. I mean, and that's what we're dealing with COVID a little bit. You're trying to convince people to take an action, a behavior change or an action, even if as far as taking a vaccination, to prevent something from happening. And then you have to say, see, it didn't happen.
Yeah.
And
I think the bigger issue too for us is like, okay, we've had kind of an identity issue for years, and we haven't had a really good grasp on being able to show the public what it is that we do and what our our brand is, if you will, as physical therapists. So it's tough to like go and add another tentacle or direction to that. But at the same time, I feel like it's the way we probably need to head if we're going to try to make, any big changes. Plus, at the end of the day, it's going to save a ton of money if we can get these people healthier earlier and just, active and moving and not going down the road of obesity and diabetes and, all of those things that we know are going to be associated with, the current lifestyles we have.
You open the door for another direction we can go if you want to, but certainly is about the challenge that schools, academic institutions are having on diversity and different students. Clearly, the numbers are there. We still have 1,200 applicants for our school, but we're trying to improve the diversity in our student application, eventually our PTs who are out there serving the public and need to look like the people we serve. And what we need to do is we're moving, down the pipeline, so to speak, and trying to recruit students, not just at the undergraduate level and not just at the high school level, but now we're talking to middle school students because they need to know what a physical therapist is and what the opportunities are for physical therapists. And if they're good in science and math and STEM, then it's not just medicine and nursing. There are other opportunities. And if we start getting out and showing them what physical therapists can do, then we will have a better pipeline of applicants and students and we'll improve our profession. So I think that's the big challenge for academia now. And that's what we're all dealing with is how to just improve, students, but how do we get a more diverse population of students? And it's not just race, ethnicity, but it's socioeconomic, it's cultural, it's perspective, it's political, all of those things. We need to do that to make our profession more respected than it is outside of our own.
And I'm sure that's a huge task that's put on the assistant dean's desk every once in a while too. Like, hey, how are we going to do this? What's the answer to this diversity and inclusion issue? So congratulations, you've got that fire to put out as well. Well, Ira, tell us a little bit about maybe a tip or a trick or just something you've learned over the years that you feel like would be helpful if somebody wanted to pursue, a dean position or an assistant dean position. What's some takeaway advice that you could give to somebody looking to do that?
Well, the first thing, as I said, is always to find good mentors, and to look for the people that have trained you or mentored you or just have been a good role model, and I've had some fortunate experiences that throughout my clinical career and academic career, including our first dean, Dr. Barbara Chapey, and then Tom McPoyle, and now Mark Ranking. So even though I've been at one place for a long period of time, I've been exposed to a number of people that I really look to as leaders. And then once you identify that, I think it's really kind of stepping up and being involved. As I said, I've always been a person that when somebody asks me to do something, like I said, I don't say yes or no, I say how and when. And I look at that because I'm there to help people. I don't like saying no to anybody. And even though sometimes that gets me in trouble and gets overburdened, and so to speak, and even balancing life-work balance, that whole thing. But it's a learning opportunity for me. I say yes because I want to do that because I'm going to come away learning something new. So I think that's it, is to jump on opportunities when you can and get yourself in different positions. And that becomes your toolbox of things that you can pull on then when you are asked to step into this leadership position. Clearly, yes, there are courses in education as a terminal degree, and I have a PhD in health and behavioral sciences, and you mentioned obesity, which was my dissertation work. So I was, you always focus as a PhD or EDD in that, but there is also an educational track that you can take as well and become, more of a better teacher, although most PhD programs focus more on research than that. But teaching is a part of it now, and certainly administration is a part of it, because it's understood as you get more degrees and more experience, you will move up a ladder and step into positions like that. So I think it's, have a course laid out a little bit so you can step in and take the right courses and education opportunities, but also listen a lot and surround yourself with good people, as I said.
I love those takeaway messages, Ira. I think that's a great recipe for trying to start to pursue something like that. So thank you so much again for taking your time and for coming on the episode to just kind of talk to our audience about that position and different avenues and pathways to get there and different traits that we might have to finish it out. We have one final question that we ask all of our guests, and that question is, if you could change one aspect of higher education, whether it be DPT or otherwise, what aspect would you change and how would you change it?
So that's easy. I was thinking, and it just popped right into my mind, but it's what's up there is the student debt issue. And again, being at a private Jesuit institution I'm not going to say we have to lower tuition, and not saying it should be free, and my administrators would come after me and everything. But we do need to figure out how to make higher education more accessible. And I mean that as opposed to in a financial aspect. In other words, can we make sure that students are getting quality education and universities are sustainable and need income for that, but without having students have a debt that is unbelievable. I mean, it's a mortgage. I mean, when I went to school, I took student loans, but I paid them off pretty quick. And my income was 3 to 4 times my loan amount. Students are upside down right now. Their income potential is 25% of their loan amount per year. So it's a debt they're saddled with that is a challenge. And I believe that's the biggest danger to us as a profession, because we need to figure out how to do that. And it may be to improve salaries and income potential, like other like physicians. Physicians have a debt problem as well, but they can service that debt much quicker because they're out there earning a higher income. So is that the method we do? Do we have more? I know people get nervous at this, but government opportunities for loan repayment. Should student loans be tax interest free? I really believe that. I mean, I believe they should borrow the money and pay it back. But why are we adding interest? There must be a way for government and financial institutions to have that be serviceable. So that's what I believe is the biggest challenge for us. And we need to work together between educational institutions, whether they be for-profit or not-for-profit, whether they be private or state-run, and financial institutions, to be able to get our students through the programs and not saddle them with debt that's going to be with them for the rest of their life.
Yeah, that's basically the number one most given answer on the show for sure, is the debt to income ratio, right? And I struggled with this a lot teaching at a private university that, graduates these students with exorbitant amount of debt. And the only way that I wrestled with it, that I was okay with teaching there, was that I could weave in some of the, opportunities that physical therapists have, even as students, for other income potentials and other revenue streams, right? Whether it be starting your own business, even if it's not a PT practice, let's say it's a marketing practice where you help get patients in the door of PT clinics, right? Or a personal training business on the weekends or evenings or something, right? Or, a blog or a book that you've written about your experience and, how it's led you to where you are today. And maybe it's something, that you have, I know I had a young man who had a brachial plexus issue at birth, and he still went through and became a physical therapist, wrote a book about it, had a podcast about it, and that was his business. He was all about helping people with brachial plexus injuries. There's a million different ways that we can use our knowledge and our skill sets that we learn throughout grad school as physical therapists. We just need to start thinking outside the box a little and addressing the ways that, we can kind of curb those student loans a little bit. If physical therapy is truly something you feel as a calling and love and want to do, you should be able to do that, and I feel like some of the programs out there are trying to address some of those things you talked about, like inclusion and, getting out into maybe some of the farther areas that are a little more out, from a population standpoint, are much, smaller, desolate type towns and areas that maybe don't have the opportunity for PT students. And we're bringing them in by using some of these flex programs and these online hybrid type programs, so some of the underserved populations, I think, and some of the smaller demographics, those get, benefit from some of these new programs. But at the end of the day, yeah, that debt to income ratio has to kind of level out a little bit, because it's bad and getting worse.
The hardest thing, and I think back now in my career that I've heard, and the most difficult thing for me to deal with has been a student who we brought in years ago, and he was a pharmacy rep, and he really wanted to be a physical therapist, and he was a diverse student and came from the South. And we brought him up, and we gave him a scholarship, and he went through PT school. And a number of years after that, I learned that he went back to being a pharmacy rep because he just couldn't afford to continue to be a PT. Now, I agree with you that PT has a lot of different opportunities, and there's things you can still do outside of just being a clinician or, being a consultant, being in marketing, we have PTs who are website designers for PTs. So they're still using their PT. I have a student who now works in developing body weight support, locomotion training for spinal cord, and she's using her PT but working as a consultant to this company. But when someone says they are leaving the profession that they really love, they're not frustrated with the profession, they just financially can't make it go for their family. That hurts because they put in 3 years of education and a lot of money, and they're still making a decision that this can't work. That's a problem for us, and I hope we can fix that.
Absolutely. Well, again, Ira, thank you so much for your time and for coming on. I really appreciate it. Where can people reach out to you if they have follow-up questions or just want to see what you're up to these days?
Well, I am at Regis University, and my email is igorman@regis.edu. Pretty simple. I've had that email for many years. I also have a cell phone. People are welcome to text me, 303-941-2700. I am on Facebook and I am on Twitter at Ira Gorman. So yeah, people can find me, and I'm always happy to hear from people and any questions. I get questions a lot about health policy. I get questions about starting practices. I've just got a question recently of somebody who wants to start a faculty practice, and I'm going to go talk to them about that. I'm from New York originally, as you said. I went to school at Stony Brook, so that means I like to talk to people, and when people ask me a question, I give them an answer. So please, everybody should feel comfortable reaching out to me, email, text, phone call. Stop by my office if you're in town.
Yeah, awesome. We'll put all those links in the show notes so people can reach you easily. Ira, thanks again so much, man. It's been an absolute pleasure.
Scott, it's been a pleasure. Thank you.